our project, we chose to do the health track. We wanted to make a project that would solve a real world problem to do with healthcare. So the first thing we did is think about our user. We wanted to choose a user who had experienced gender discrimination, and we thought about choosing women and minority people who often experience discrimination when they're going to a doctor. So some of the reasons that they can't get the same level of healthcare that other people can is that doctors don't really trust them to accurately report on their pain, to accurately report on their symptoms, and they kind of tend to feel like they're crazy, which makes women and minorities feel like they are not being heard and they won't get the same treatment that other people do. Women and minorities, according to studies of hospitals, they wait longer in the waiting room. They are less likely to be tested and more likely to be diagnosed with a psychosomatic illness instead, and they overall just get worse healthcare than everyone else. So to try to solve this solution, we thought about our user and the problem, and we brainstormed so many different types of solution. We thought about a platform that compiles your medical records and your symptoms. We thought about a healthcare AI buddy that might help support you in a doctor's office, and eventually we came to a solution on a mobile app. We compared it to some competitors that are a little bit similar, but ours is unique in that it does help you compile and track your symptoms as well as your medical records, but it also turns that information into something you can use to communicate with your doctor. So now we're going to go through our prototype. So we decided to name our app Next Health because one of the important things we looked for is an app that could tell you not just what you've already done, but where you're going to go next. We wanted to give healthcare that's very clear and very simple to use. So assuming that you're a user, you would just log in, and then this is your home screen. It says, "Hi, Juliana, welcome back." And you might look at your medical history or track some symptoms, but in this case, it says that you've been tracking for 30 days and you want to see your next steps. Where do I go from here? So this is the next steps page. When you go through here, it organizes your next steps by category. So in this screen, you're looking at your mental health, like what might be suggested for mental health. Instead, you're gonna move over to the general screen. You see there's been 6 months since your last checkup. So what this app is encouraging you to do is maybe schedule another appointment. So if you click over here, you'll be able to go check your medical history. When you look at your medical records, you'll be able to tell things like look at your symptom tracker or see what kind of appointments you've had previously. So in this case, our last checkup was with a sleep specialist, Dr. Shankar, and maybe we want to schedule another one of those appointments to follow up. So in that case, we click over to our appointment scheduler, and you can actually divide your medical history or filter it by doctor. So we want to set up an appointment with Dr. Shankar, so we're going to click on doctor. That's going to filter down to the different doctors that we've seen. We've seen Dr. Shankar, and so we want to contact her to set up an appointment. So we'll set up to contact her. Then this is the most unique feature of our app. In addition to offering you resources that will help you talk to a medical professional in a way where they will listen and understand your concerns instead of dismissing you right away, it also gives you an option to show them your history. So when you click on this button, what it will actually do is allow you different options. You can view a PDF, print it, email it, or fax it. And what that PDF is it's a summary of all your medical history, all the symptoms you've tracked, all the procedures you've had, all the appointments you've been to. So when you show up at a doctor's office, you're not required to maybe try to speak to someone in a language that's your second language or be really intimidated by a doctor who's immediately dismissive of you because of your gender or your race. Instead, you have this printout that makes you seem credible. Here's all the things you've already done, and here are some next steps for you and the doctor to look at together. So what our PDF looks like, I'll show you over here in the wireframing section. This is an example PDF for Juliana. So it includes things like just a little information about the patient, their preferred language, any known ailments they already have, and then it shows like a recording of their symptoms and medications. It gives the doctor suggestions of possible things that they may have based off their symptoms. That way a doctor doesn't just immediately dismiss them, but gets a chance to think about maybe something they wouldn't otherwise think about. And then it will give them notes from previous doctors, which is part of the credibility. They want to see that another doctor has actually already looked at this. And lastly, it will show their immunization record so that when they make an appointment and go, the doctor basically has all of their health information in one place. And then they will appear credible instead of being dismissed, and they can move forward and get the same standard of healthcare as everyone else.